what it's like to be part of NADG, but to actually take advantage of some of the outstanding benefits that we have within the company. So wanted to share a little bit of a story with Dr. Matta.
Interesting thing that I was looking at some of our internal statistics, and we just launched this great periodontal and oral systemic health initiative, and we look at our own team members and how they can embrace it. It was a surprise to me that actually 70% of our team members haven't actually used any of their dental benefits this year. So that's telling me they haven't been, and that's whether it's internal to the company, and we hope that we're taking care of our own team members, or outside. So they haven't been to the dentist in any capacity this year, and that's, you know, disappointing that 3/4 of our own family haven't utilized their coverage. So, you know, you've been with us now for over a year. You came in, you know, became a part of the dental benefit package. Tell me about how you've utilized it.
First, I started off with a little bit of an education, because coming into dental and not knowing anything really about it, I just took for granted that my provider was giving me optimal care. And nothing against my former dentist or hygienist, but when I changed and I just signed up for regular cleaning like I would, I went into Dr. John Matta's office and saw Kim in the hygiene department, and it all changed from that point. I knew something was going on that didn't feel quite right. And she looked at me immediately and said, I'm not going to give you a bloody prophy. I'm going to, here's what I suggest. And I was blown away by two things. First of all, my negligence. And second of all, how for 20 years I was just told, oh, you have great teeth. You know, never had a cavity. Everything's good. They'd clean and send me on my way. I went in for a scaling and root planing, correct? Did I say it correctly? See, I'm starting to understand. So they did one half one day, and I came back 3 weeks later to have the other half done. And within those 3 weeks, I could tell the difference. My right side of my mouth felt amazing. The left one, I still felt embarrassed. When I went back, I was happy to find that when it was done, no pain. Kim was phenomenal. The music choice was kind of lax, but we figured it out by the end. When they came back in and I went to, you know, check out, everything was covered. I kind of understood it a little bit because I've been in that world. And the antibiotic was the only portion that I had to have out of pocket. So I took advantage of it. My mouth feels great. I'm keeping up with the maintenance, and I go back in 2 more months just to keep it in. I've learned now that you can't get rid of periodontal disease, it'll only go in remission. So I'm hoping to keep it in remission.
Yeah, well, that's the first step, is proactively evaluate, treat it. It's great that the team there was proactive with both the evaluation and the treatment. So I think the biggest, you know, ask for the team members is, let's just make sure that we're taking care of our own health. So not only did you help, you know, your mouth and the oral health that you had as you talked through, but it's profound what that was doing to your overall health. You know, it's this silent disease that is really creating inflammation that your heart is dealing with, that your whole body is dealing with. So one, great that you have received that treatment, that it's in remission, your whole body is healthier for it. So as team members get into your practices, you're there on a day-to-day basis. The vast majority of our organization, it is right there at our fingertips. So get into the offices, use the month of October to give each other examinations and treatment, and let's make sure that we are healthy as an organization, and then making sure that we understand and are proactive with ensuring that our patients are healthy. So glad you got that care, and we want